Very good morning to all. Today's topic that I am going to take is catheter associated urinary tract infection. In short form, we tell as COTI care bundle. This infection occurs when a patient is having a urinary catheter. So, regarding this, the infection may vary, depends upon the patient's care. There might be signs and symptoms that the patient will be feeling more itchiness, burning sensations. Ladies and gentlemen, let me tell and explain about the COTI care bundle. There are some points which is being mentioned as the maintenance bundle criteria. A patient who is being admitted in a hospital or in a home or in a elderly home care, the patient needs a catheter because when he is not able to pass the urine, or when there is when he has been met with like when he is bedridden in a hospital or at home, some of the safety measures that we need to take care. So the first point is maintaining a sterile continuous closed drainage system. That means if once the patient is being catheterized by a hospital, the doctor or the nurse, we need to maintain a sterile system because this is a closed drainage system. We should not disconnect the catheter with its urinary bag because there may be having a higher chance of getting infection for the patient when it gets the exposure with the atmosphere. So that is being maintained sterile during the insertion procedure. The catheter should be properly secured in our inner thigh to prevent any urethral traction. That means if the patient is a bedridden patient, may knowingly or by unknowingly the patient may do, because sometimes it depends upon the patient's case. If it is a neurosurgery patient or any patient, those who are not conscious oriented, they may sometimes pull the catheter. So even during the sleep, during the night times, there might be a higher risk of getting pulled for the catheter. So what it happens when the catheter gets pulled, the urinary catheter inside the urinary bladder may cause injury to the urinary tract and to the bladder. This may cause bleeding. So this may also cause, and this will also be a higher risk in getting infection for the patient. The next point is keep the collection bag below the level of the bladder at all the times. That means if the patient is in bedridden or in the bed, the urinary bag, the collection bag, it should be placed below the bladder level. That means it should be below the bed but above the floor. It should not touch the floor also. So that due to the gravitational force, the urinary catheter, the urine passes through the catheter and it gets passed and get collected to the urinary bag. Okay, and that urinary bag should not touch the floor to prevent from infection. Next point is maintain unobstructed urine flow. That means by accidentally, sometimes during the sleep, the urinary tubings, tubings of the urinary bag may get folded, and that means kinking. So please avoid it and not to get fold. The folding or gets kinking of the urinary tube or the catheter tubes, that may prevent. So there is an obstruction so that the urine flow will not be proper. So we need to maintain a very good unobstructed urine flow so that according to the gravitational force, the urine may flow freely and get collected inside the urinary bag. Once the urinary bag gets filled nearly 3 by 4th, we should discard the urine because If it gets overfilled, there might be a higher risk of getting spillage of urine inside the room or the patient care area. So we need to maintain a separate clean containers while discarding the urine. So there is a drainage tube at the bottom end of the urinary bag collection. So while you are discarding it, make sure that the drainage tube should not touch the bowel, because there might be a higher risk of getting infection inside the urinary bag. So please make sure whenever if the patient is at home, if the parents, if the relatives or the bystander who takes care for the patient, this is very much important that this should not get contaminated. Okay, and make sure that the container or the bucket what we use to collect or empty the urinary bag, that should be neat and clean. After the collection of this urine, please clean the bowel properly and make it in a sun to dry. The next point is maintenance of metal care with a routine hygiene. That means cleaning the private part area very properly. We need to use either a good soap, that means a mild soap and water, and clean the private area to prevent from the infection for the patient. Because externally, whenever we insert any catheters to a human body, there is a higher risk. If we do not maintain any sterile techniques, there is a higher risk of getting microorganisms or the bacteria inside our body. So we always should maintain and well hygiene in our private part area. During the hospital stay, the patient who is admitted, we will check for its necessity. Do we need to continue the catheterization? As doctor says, please check the patient's bladder, and we need to give a bladder training, because once the patient has been catheterized, the doctors advise us after a week or 2 to 3 days, please check for the bladder urgency. That means we need to clamp and stop the catheter so that we will know there is a necessity to continue with this catheter or not. If not, then please we need to disconnect and we have to remove all the urinary catheters so that to prevent from infection. Prolonged catheterization or prolonged time is being kept in a human body or a human bladder. This may have a higher risk of getting infection for the patient, and this may result of getting patient fever, burning micturations, irritations, and some highly infectious bacteria get infected inside the patient's urinary tract infection. This may lead to several other disease conditions. Next point is we need to teach the patient's family. If the patient is getting discharged, we need to explain well about these procedures and make sure that if it is a rubber catheter, we need to remove the rubber catheter every 14 days. If it is a silicone catheter, make sure that every 28 days or 1 month, max to max 1 month is allowed, because if we keep it for a prolonged period, that may also cause the patient and lead to a temperature. There is a higher risk of getting patient with fever. So dear ladies and gentlemen, very good explanation for the patient bystanders. It is very mandatory that we need to give him. Otherwise, due to the improper care that the patient gets at home or in any sector, for the patient's safety and to prevent the infection, we need to follow all those points that is being mentioned in this slide. I hope that this some of the important points what I have discussed is well understood, and I wish that each and everyone who takes care of patient of any age group. Obviously, patients at the elderly are more prone and immunocompromised. They are more prone in getting infection at this age. So, prevention is better than cure. So, please try yourself and please make the patient free from infections and lead a healthy lifestyle. If the patient needs to get removed, or if you feel that there is some frothy and pus color of formation inside the urinary tubings or the catheter, if you feel anything or the patient complains of the lower abdominal pain or burning micturition, please take the patient to your nearby hospital or to the clinic and please get treated. If required, please replace it with the new one for the safety of the patient. Thank you. That's all from my end. If you have any queries, you may please leave a comment or text me. I will provide all the details in the bio. This classes or this topics what I have discussed is everything taken by the reference of CDC and WHO, Center for Disease Control, and the World Health Organization. These are the guidelines that I have been taken. Thank you so much. Please do not forget to do hand hygiene. Wash your hands properly by using a very good soap solution, and please don't forget to use a sterile gloves. It is called a hand care that is being available in pharmacy. So please do not forget. Thank you.